Welcome, everybody. It's a great pleasure to say hello to all of the individuals who have joined and who have shown enthusiasm to attend the workshop. This is a metabolism-based workshop. It's focusing on epilepsy in addition to other conditions. And I am delighted to introduce the sessions in conjunction with my co-chair, Dr. Mackenzie Cervenka. I am a neurologist. I work at the University of Texas Southwestern Medical Center in Dallas. I'm also a neuroscientist, and we're particularly interested in brain metabolism and conditions that impair brain metabolism, in addition to utilizing metabolism as a potential treatment for other conditions that involve the brain.
My name is Dr. Mackenzie Cervenka. I am an associate professor of neurology at Johns Hopkins School of Medicine, and I am medical director of the Johns Hopkins Adult Epilepsy Diet Center. Welcome. Here are our disclosures. First, we just want to say thank you. I would like to thank all of our speakers, and so would Dr. Pasquale, our moderators, and you, our audience, for making this workshop a success, and the NIH, NINDS, and NIDDK, in particular, our conference organizers, Dr. Adam Hartman and Dr. Vicki Whittemore with NINDS, for giving us this opportunity to contribute. Here, we will provide a brief overview of the pre-recorded sessions.
To begin with, we would like to justify why this is the appropriate time and context to be having the workshop. Why have we chosen the topic? Why is it relevant? And why the different speakers that are going to lend their expertise. I'd also like to reemphasize that Adam Hartman has been instrumental in getting the agenda lined up, and the concept has been wonderful to work with to prepare what we think is a terrific workshop. One fundamental aspect is that metabolic-based treatments are actually feasible. By that, we mean that there is usually more than one way to modulate a metabolic state. Metabolism is highly redundant in many ways, and there is always more than one pathway to get to the same product, to get to the same mechanism, to get to the same end result. And so that offers a great deal of feasibility that we normally don't have when we're dealing with other kinds of interventions. In relation to that, metabolic treatments are actually generally more natural than interventions that have to do with manipulating a biological state using other tools. For example, compared with seizure medications or epilepsy surgery or devices, metabolism does take advantage of a natural process and normally will augment the natural process. The other kinds of therapies that I just mentioned, though, normally work through either inhibiting something or trying to enhance inhibition as an end result. And those are things that normally tend to have more side effects because inhibiting a process is usually much more prone to have ramifications onto other processes that may not be very well known. In contrast, metabolism, it's a little more physiological, and there's usually more ways to modulate it. And normally, as you will hear along the workshop, we're going to be talking about augmenting or enhancing or simulating metabolism rather than suppressing metabolism. And that comes with normally fewer side effects. So we have structured the sessions along 4 main topics, and I will cover the main 2, which will be dealing with an overview of the basic mechanisms and how to conduct some of the research. And the second will be focusing on particular metabolic interventions. And then Dr. Cervenka will go through translational clinical aspects. The main overview here is that, of course, we have known that ketosis is a very effective intervention for not just epilepsy, but for other conditions. it's very clear that the organism will respond in very specific ways to the induction of ketosis. Many of those ways are highly beneficial. And what's been done is to replace, as many people know, a great portion of the carbohydrate and protein in the diet with fat. That leads to the production of ketone bodies, and those have a therapeutic effect, either directly or indirectly, as we will see during the workshop. But those are difficult to maintain situations in many cases because there are issues with maintaining the appropriate insulin. There are issues with glycogen stores, and there are changes in hepatic metabolism. And so even though ketones are greatly beneficial in many cases, and they're great to maintain cardiac and skeletal muscle and brain function, there are practical implications in terms of the maintenance of ketosis and the consequence of ketosis. And so we use these frequently, and animals have been adapted to a lot of these interventions, and people who starve do this physiologically also, but there are limitations. And so on the right-hand side, for example, you can begin to comprehend the complexity of the topic and also the rationale for some of the areas we're going to be covering, because a great deal of these mechanisms have to do not just with metabolism per se or the administration of something exogenous or dietary, but also things like the microbiome, things like inflammation, things like hormonal regulation, all of which are to some degree manipulated or controlled or determined by the outside, all of which are now known to have a significant impact on epilepsy and epileptogenesis. And so this is the overview for the entire first two sections. We are going to be discussing to begin with an overview of the how does the field look like today in comparison with a few years ago. We have a scientific perspective, and we also have a patient advocacy perspective. We would like to comprehend how have things evolved over a few decades, and what are the fundamental findings that we're utilizing today, and how do patients perceive the situation from their end? What do they see that has changed? Second, I'll be covering some of the rationale for metabolic therapy in epilepsy, but also amplifying that to other conditions, including dementia, including cancer, and so on. And next, we're going to be covering the different varieties of brain fuels. There are many of them, and some of them are highly effective, some of them are not, and they all come with limitations and advantages, and that will be discussed. And finally, there'll be a discussion on what does it mean to be transparent in research. How does research need to be conducted to be replicated, to be disseminated, to be clearly reliable? What criteria, what different mechanisms, what resources, what tools could be utilized, should be utilized to make it very high impact. And then moving on to the second of 4 sessions, we are going to be covering individual metabolic interventions or individual metabolic components. Obviously, there will be an important ketone body section where we'll get to hear about how to induce ketosis, what other ways could you do in addition to a ketogenic diet, how do they work. And then second and third and fourth, there are emergent constituents of different diets or different products that have been proven to be very intriguing and very interesting in brain function and in epilepsy as well. Many of them have been known for a very long time. Some of them are fairly recent or recently rediscovered along the lines of amino acids, fatty acids, and whey, each of which have very specific mechanisms that we'll get to hear. Moving on to the next topic, this is the contrary of all of the above, in that we're not applying something in this one case, we're actually taking away something. And the lack of that something is also beneficial in many cases, and there are mechanisms why that should be also the case. So we're talking about calorie or nutrient restriction, which is something that has been known since 100 years ago when the ketogenic diet was discovered. And then finally, we'll get to hear about the microbiome as a very important component of course, It's a first step in metabolism because we own the microbiome in our digestive tract, and we're to some degree determined by what the microbiome does to our gut, and that's essentially how metabolism begins.
Thank you, Dr. Pasquale. In the last 2 sessions of our pre-recorded program, you're going to be hearing about translational metabolism-based therapy research, as well as clinical trial design of metabolism-based therapies. We're going to be learning about best resources. We'll be hearing about other resources through NIH and NINDS, recent research on metabolism-based therapies in the clinical arena and in translational research, and also perspectives regarding patient involvement in clinical trials. In session 3, we're going to be discussing specifically translational research as it pertains to design of metabolism-based therapies. You will learn about biomarkers of ketogenic diet action and utilization of biomarkers, endpoints, and other tools, or BEST, devised by the FDA NIH Biomarker Work Group, and how these tools can be incorporated into the design of metabolism-based therapies. You'll next hear about bench-to-bedside and bedside-to-bench translational research in metabolism-based therapies, as well as hearing answers to questions of how and why to pick specific animal models when designing studies to examine efficacy of metabolism-based therapies in epilepsy in preclinical research that are most meaningful for future clinical trials. This session concludes with a presentation of a variety of exciting opportunities and resources offered through NIH and NINDS to promote development of drugs and other therapies, including metabolism-based therapies. The final pre-recorded session focuses on aspects of clinical trial design of metabolism-based therapies. The first speaker will introduce the concept of master protocol trials and consider different types, including umbrella, platform, and basket trials, and the merits and limitations of each approach. You'll hear a presentation of concepts underlying designing a robust statistical analysis plan in clinical trials, taking into consideration how to handle missing data through multiple imputation and other strategies. You will hear specifically about challenges inherent to design of metabolism-based therapies, such as addressing high non-compliance rates, blinding or inability to do so, and longitudinal follow-up. You will hear about several metabolism-based ketogenic diet therapies and randomized clinical trials that have been designed to evaluate efficacy in patients with drug-resistant seizure disorders and specific epilepsy syndromes. There will be a review of a recent Cochrane study, as well as discussion of the limitations and challenges in designing and implementing these trials. There will be a presentation that is specifically focused on the dietitian's perspective on different approaches to metabolism-based diet trials with the perspective of diet design and preparation, improving compliance, and in particular taking into account patient motivation, support structures, and socioeconomic disparities. Finally, you will hear about patient and family-centered considerations when designing clinical trials and which emphasize the importance of the patient voice and the concept of nothing about me without me. We hope you enjoy the pre-recorded sessions and join us for the live content with our conference organizers. With Director of the NINDS, Dr. Walter Korschetz, our speakers and moderators, as well as the rest of our team. And thank you.